Hello, I'm Dr. Buğra İpek, and I wanted to talk about a gluteal augmentation using fat grafting, aka BBL, Brazilian butt lift, and let's see our patient's results. So here we are seeing my patient's front view. What we tried to achieve here was do liposuction on the waist and tummy and decrease the width of her belly and flanks while giving volume to the hips. Now what we want to achieve is kind of an hourglass shape with a slimmer waist and a larger hip and a smooth transition from waistline to hip. So basically the most common problems patients have here is the so-called hip dip area, where you have the wideness of the hips just narrows down and creates a valley, and then you have your pelvic bone creating a increased area, and then if your waist is not slim, then it either goes straight up or you might have a rough waistline, but still that curve is usually undesirable, and most patients just want to have a nice slim waist and a wide hip with a curve that just goes smoothly. So we try to achieve by doing liposuction on the positive areas, which we want to narrow down, and we give some fat to some negative vectored areas. And moving forward, when we look from the side, we slimmed her and flattened her tummy, and then just gave some projection to the butt. Now this patient had already a large gluteal region, and we just increased the size of it and also mostly gave shape. Of course, this is her 3-month result, which will look even better in 6 months, but she didn't look like this when she first got out of surgery. She had bruises, she had swelling, but it takes at least 3 months before you start to see beautiful results after liposuction surgeries. You will see the difference right away, but because of the swelling and the wound healing process, you gotta be patient, and if it's your first liposuction, then usually 3 to 6 months is where you start to see some results. But if it is a secondary case, a revision case, then you might want to be more patient and at least wait 6 months to up to a year to actually see a result, because your wound healing is going to be much slower. Here we are also seeing her from back, and as you can see, we have created a smooth transition from waist to gluteal regions. Her back rolls have decreased a lot. Now, we might not be able to get rid of these back rolls completely with just liposuction. Depending on you, you might need something more extreme for that. But worst case scenario, the back rolls, they will decrease. Also, when you see the waistline, we slim it down as much as your anatomy lets us do it. And then the hip dip area is filled, and we try to give a reversed heart-shaped gluteal region. Of course, this also depends on what your initial anatomy looks like, so not everything is achievable with everyone, but we always discuss this with you in our consultation. Thank you.